But today we're going to talk about population management in animal shelters. I'm Dr. Colleen Guilfoyle. I am one member of the National Shelter Medicine team at Best Friends Animal Society. There are a few other members of our team that are on this Zoom today. And so what I would encourage you all to do is to use the chat box for any comments. You can comment on the content or give your lived experience or commiserate with other people in the discussion, and then use the Q&A box, which is separate from the chat box, to ask questions. And if they're super simple and straightforward, someone from the National Shelter Medicine team will just answer it at a point in time. And then if there's remaining questions at the end and we have time, we'll address those then. So we are hearing and experiencing that animals are staying longer and getting stuck in our shelters. This has a dramatic impact on animal health, staff morale, and life saving. Today, we're here to talk about ways to keep those animals moving through the shelter using data and metrics, evidence-based life-saving programs, and proactive population management strategies. Ultimately, this means better welfare for the animals, and it means that things are better for us, the shelter workers, as well as getting more animals out of the shelter alive. And I want to pull on that word evidence-based and mention that one of the members of our team, Mal, will attempt to drop links to the papers that we reference in the chat as we go through the webinar. But if there's any resources you specifically would like, reach out to us via our email at the end of the presentation, and we'll try to get those to you. So, what do we think of when we think of population management? Go ahead and use the chat and drop in what words you think of when you think of population management. I see controlled intake, daily rounds. Yes, those are both great ones. But we also want to think of a very diverse array of different programs. So it includes all of the things that happen before intake, at intake, during an animal's stay, how they move through the shelter, and how they leave. It also involves how we interact with our communities. Today, we'll dive into many of these topics, and we'll see how we can help with all of those dogs that are in your shelters. So length of stay. When we define length of stay, it is the time that an animal spends in the shelter's care. This includes both animals that are in the shelter and in foster care, and we measure it in days. And why does length of stay matter? We know that if animals stay in the shelter long enough, they will get sick. We also know that no matter where an animal comes from, the shelter is a new and a stressful place. We know it costs money to care for animals every day. The cost of consumables are directly tied to how long an animal stays, and we'll get into some of that math later. And finally, increased lengths of stay decrease our capacity over time, limiting our ability to save more lives. And I'm hoping we can demonstrate that to you today. Okay, so we know that the longer the length of stay, the more animals that get sick or they get sicker, they await medical care, and they have decreased adoption likelihood. And this is a negative feedback loop that goes around and around. And it results in poor welfare too. More animals spending more time in the shelter means more crowding, and that further accentuates our cycle. So let's look at an example, super simplified. We have shelter A, who has an average length of stay of 3 days. They have 3 dogs come in every day, and they have 3 adoptions per day. We have shelter B, who has an average length of stay of 1 day, so 2 days shorter. They have the same number of intakes every day at 3 per day, and they have 3 adoptions per day. So we have day 1, shelter A and shelter B both have the same number of intakes and the same number of adoptions. Day 2, 3 dogs in to both shelter, but on day 2, shelter B gets 3 dogs out. Day 3, 3 dogs in to both shelters, and shelter B gets 3 dogs out again. Day 4, 3 more dogs into both shelters. And on this day, shelter B gets 3 dogs out as well. Day 5, 3 more dogs enter each shelter, and 3 more leave in each shelter. So now both shelters have entered a steady state. So this means their intakes equal their adoptions. Day 6, same thing, 3 dogs in, 3 dogs out of both shelters. When we look at the population density, shelter A has a ton more dogs. So if we have the same number of intakes, the same number of adoptions, and the only difference is the length of stay, both shelters will eventually reach a steady state where intakes equal outcomes or adoptions. But the daily inventory in shelter A is 2 to 4 times as high as shelter B. And it's one thing if we're talking about 12 dogs on a PowerPoint slide, but in the real world, this is the difference between 100 and 400 dogs. We know what that looks like, we know what that sounds like, and maybe most importantly, we know what that difference feels like. So length of stay affects crowding, but what else? It affects the cost of care per animal. Some things we pay for regardless. So the cost regardless of length of stay, and that's things like spay and neuter, vaccines, deworming, heartworm tests. But some things increase, and that's things like staffing and consumables. And so how do you actually do the math to calculate what this costs? So we can add up our consumables and our staffing costs per year, and then we divide by the number of animals per year, and that gives us our cost per animal. And then we can take that number and we divide it by our average length of stay, and that'll give us a ballpark idea of a cost of animal care per day. So here's the question everyone wants to know. What is our target length of stay? And the answer is it varies. So different shelters have different community needs, different mission statements, different budgets. And so they may have a different target length of stay. Different populations can also have different target lengths of stay. So animals we know that are less than 6 weeks typically stay longer until they're old enough to be spayed and neutered and adopted. And we find that other populations have different target lengths of stay as well. We do have some general goals that we try to achieve, and that's always less than 14 days. For our fast track pets, those are the ones that we know just fly off the shelves and out of their kennels. Our goal is less. It's as short as we can possibly get it. For RTF cats, we don't want to see those cats staying in the shelter for more than 2 to 3 days. Often the shelter is extremely stressful for those cats, and when their pathway is assigned to be returned to the field, let's get them there as quickly as possible and free up that space. Okay, poll. So you can go ahead and put in the chat, are you familiar with the ASV guidelines? And our options are no, tell me more. I know they exist, but I haven't read them. I've referenced them a few times, or I reference them all the time and read thoroughly. I can't see the chat anymore, but I'm excited to see all your responses later. And if you're in the group that you haven't heard of them before, then that's your new homework. We are introducing these guidelines here because we're going to pull some definitions and baselines from here. And from here on out in the presentation, we'll just call them the ASV guidelines, but it's the Association of Shelter Veterinarians Guidelines for Standards of Care in Animal Shelters. And so the ASV guidelines from here on out will be where we pull a lot of definitions from. So now let's define capacity for care. So in the ASV guidelines, it says every sheltering organization has a maximum capacity for care, and the population in their care must not exceed that level. The word must is highlighted here on purpose, and it's because in the ASV guidelines, they use these words must and should, and they have very clear definitions about what that means. And so in the must category, those are things we must do or not do to ensure humane care of animals in our care. Capacity for care means meeting the needs of every animal admitted to the shelter, regardless of how they came in, when they came in, their age, their health status, or their personality. Every sheltering organization must acknowledge their capacity for care and function within it to allow them to be the best resource for the animals and the people in their community. So that's the idea of what capacity for care is. And how do we actually calculate it? What's the actual number that is associated with our organization's capacity for care? The common misconception is that it's just the number of kennels we have. And we all know that it doesn't matter if we have 200 kennels, if we only have one staff member to care for them, they can't care for 200 dogs. So there's a few things we look at. We look at humane housing space. And when I use humane housing space, that's defined in the ASV guidelines as well. And so that's what we're referring to when we say humane housing. There's very specific definitions in there, and some of the parameters include size and double compartment and other factors, but that's what we're referring to when we say humane housing space. So we may look at humane housing space. We'll also look at staffing levels. We'll look at adoption-driven capacity sometimes. Sometimes that's the best answer, is how many adopters are coming through your door on any given month to determine your capacity to facilitate those adoptions. Those are a few different things we want to look at. So we'll look at a couple of these. So dynamic housing capacity looks at a time period, because we all know that July looks a heck of a lot different in our animal shelters than November. So how many animals can we house in a specific period of time? And we want to calculate this for different populations as well. The more nuanced we use in breaking this up into categories, the more accurate it's going to be. So we think about kittens versus large dogs. Maybe we think about animals that come in with ringworm. So we're looking at dynamic housing capacity. The more we break it down into chunks of what population we're talking about and what time period we're talking about, the more accurate information we're going to get. And so we look at dynamic housing capacity. It's the number of humane housing units, once again, as defined by the ASV guidelines. Oftentimes, when we transition to humane housing units from, say, single compartment, small housing to larger housing that's double compartment, or we portalize cat kennels, we lose space to house more animals. And we'll look at what that means in a couple of slides. I just wanted to highlight that again. So the number of humane housing units multiplied by the number of days in the period of interest. So this is often when we're talking about July. So we look at however many days are in July. I think that's a 30-day one, but it could be a 31, I don't know. And we divide by ALOS. So what that means is just average length of stay for that time period. And that'll give us our dynamic housing capacity. But what about staffing? We just said if we fill all our housing units and we don't have anyone to care for them, then that's not inside of our capacity for care either. So what about staffing? How can we calculate? And this is the basic formula. We take the maximum animals per day in a period, and we multiply that by 0.25 hours of care per animal daily. And that gives us our recommended total daily staff hours for basic animal care. And we need to highlight that this is just the minimum baseline, and it's likely just an arbitrary number because we had to make one up to start working on these calculations. The 15 minutes per animal is too a lot for basic cleaning and feeding only. And the reality is this varies by shelter, and it also varies by animals within the shelter and meeting different needs. We know the mom with 5 kittens doesn't necessarily take over an hour to provide care to, but we also know that our large active dogs who need enrichment and other things while in our care require more time as well. So what we really need is a time study that looks at how long it actually takes to provide humane care for animals. And we don't have that yet, but we use 15 minutes as the bare minimum staff time we need to care for animals in our shelters. So how do we operationalize capacity for care? In this study, looked at 3 shelters before and after a capacity for care model for population management was implemented. This included increasing housing space for individual cats, which decreased the number of housing units they had on site, as well as maintaining their populations at their calculated optimal capacity. And it was a capacity that was lower than what they had been previously operating at for all 3 shelters. And what they found was that cats in isolation decreased, average length of stay decreased, and cats had a higher probability of adoption and a lower probability of dying or being euthanized. And so when we look at this paper, I think it's a great example of how we can take capacity for care, turn it into an operational standard, and use it for better outcomes for our pets in our shelters. And so when we look again at the effective length of stay, we have shelter A. There's 50 kennels. They have an average length of stay of 30 days. How many dogs can we care for in a year? 608 dogs. Shelter B, same thing, we have 50 kennels. We're assuming we are operating at maximum capacity at all time for both of these shelters. They have an average length of stay of 7 days. So how many dogs can we care for in a year? And the answer to this one is 2,607 dogs. And this is a bonus effect of reducing our length of stay. This is a simplified example, but it shows the power of reducing our length of stay. When we reduce length of stay, we can move more animals through the shelter over time, so we can save more lives. And this is our National Shelter Medicine mantra: every single day matters. If we look at a daily inventory example with an annual intake of 5,000 dogs, an average length of stay for 14 days, we have a daily inventory of 191 dogs. Reduce the length of stay by 1 day in this shelter to 13 days. Our daily inventory is 178 dogs. That's 13 fewer dogs to care for every single day in our shelters. And what else could we use that time for? Things like enrichment, things like community outreach. If you're understaffed, this is going to be a huge relief to your staff to have less animals to care for every day. And if you're fully staffed, they have more time to do other things to enhance welfare and also do things like community programming, intake diversion, things like that. Okay, I've thrown enough math at you, I think, to make a point about why length of stay matters for so many reasons. But what do we do about it? What are some strategies we can use to actually help us reduce our length of stay and keep animals moving through our shelter? Okay, so I present this to you as an analogy, and I think a lot of you will see where this is going. But what happens when a patient arrives at the emergency room? Go ahead and throw in the chat if you've been to the ER lately, or if you're an ER vet, or what happens when a patient walks into the ER. This can be human or animal. I think I might be able to see the chat. Triage. Ooh, yeah, triage. I love it. Yeah. Those are exactly right. And the answer of what happens next is it depends, right? Did they walk in? Were they brought in by an ambulance? What are their clinical signs? Trained staff listen to the scenario, and maybe they send out a nurse to collect vitals, but not always. Patients in the emergency room are triaged according to their condition. What would it look like to embrace this approach in the animal shelters we work in at the admission desk? So we might ask questions, we might try to find out why the pet parent sought help. We might try to find out what kind of help the pet needs, which may be different than the reason help was sought. We need to figure out how quickly the pet needs help and who's the best person to help this pet. Is it the shelter or is it someone else? And I want to highlight that you can be open admission and use triage managed intake. And I included this example in my notes because I think it's really funny. I recently went to a happy hour with one of my colleagues and friends who works in human emergency medicine. And she assured me that when she's working in the ER, they do see everyone every time, but she can't even imagine what it would look like if she had to admit every patient that walked into the ER. So I thought that was a really good example of highlighting what this triage and managed intake can look like. So in addition to triage, which means who needs our help right now, what else does managed intake include? And so there's things like pet retention, really digging in, finding out why they need to surrender their pets, and can we offer them anything to help them keep their pet? And we'll talk more about that later. Rehoming support, can we direct them towards resources to find a new home for their pet without coming to the shelter? Partnering in animal health. What can we do to ensure the pet has the safest transition to the shelter? And I think the example I think about so often with this is puppies and kittens. If there's any way we can get a vaccine or two on board before they get to the shelter, I'm going to do everything in my power to make that happen. Utilizing foster. If it is a stray animal, can the finders foster? Would they be willing to learn about taking care of kittens? Can we arrange foster pickup without staying in the shelter? And I think Another exciting strategy is to think about if their ultimate pathways to go to a rescue partner, can they go to the rescue partner without ever stepping foot in the shelter? And this might be the most important one, even though it's listed last, but field services. Shift from how do I get this pet to the shelter to how do I get this pet home? What resources can our officers provide in the field to keep those pets from coming into the shelter? This is it's more of it's not necessarily a study that's looking at triage and appointment-based admission, but it is a great description of what this looks like and how shelters are using it and how you could potentially implement it in your shelter. So using appointment-based admission to your shelter and triaging it based on need. And the things that come from this that are really positive are that we get useful information about the animal. We have more predictable workflow. So this is good for the people in our shelters as well. Improves staff morale when they have an idea of what's going to happen next. We can find the right solution for every pet. And so that might not always be coming to the shelter, but sometimes it is. And it means more live outcomes for animals. So intake diversion. I think sometimes we get the idea that intake diversion is just saying no. And it's really not. It's more creative than that and sometimes more work. It's offering resources and alternatives. And sometimes it's saying not right now. So it starts in the field, shifting from a punitive approach to community engagement, returning pets to their owner in the field, and empowering our field services officers to provide resources in the field. At the shelter, it can look like a pet resource center. It can look like food, providing housing and fencing, behavioral resources, or maybe medical resources if that's within your bandwidth, rehoming support, finding the owner, and comparing cost of intake and caring for that animal to owner retention. And we'll look at that in the next slide. Staffing consideration. I think this is so important. Our frontline workers, whether they're field service agents working in the field or whether there are client service representatives working at the front desk and answering phones, this is one of the hardest jobs in our shelters. They talk to people that may be emotional because they're surrendering, and they've already decided that by the time we talk to them usually, or we're telling them something they don't want to hear. And these are really hard conversations. And so when we think about the people in our shelter, I want to encourage everyone to train these people in intake diversion and life-saving programs, support them and acknowledge that their job is really hard. And whenever we can, pay them and pay them well. This is not a minimum wage job. This is a hard job. And so I think just acknowledging how tricky this can be. So here is one of my favorite papers of all time. It is came out of Memphis, Tennessee, and it's the impact of incorporating multiple best practices on live outcomes for a shelter in Tennessee. And so they did a few different things, but one of my favorite things they did in this paper is they calculated the average cost of care per animal at $309. So anything up to that amount, so anything $309 or less, the front desk could help provide that for the owner without getting any approval. So this could include training, this could include vet bills, this could include pet deposit assistance, fencing, anything we could to keep them out of the shelter if it was below that $309 mark. And they could sometimes provide more, but they had to get some approval. This is just what they could provide to an owner at the front desk. They incorporated other strategies as well, including return to field for cats, RTO in the field for dogs and cats, open adoption and managed intake. And I think they achieved a lot of things, including shortened length of stay and increased adoptions. But one of the most beautiful things I think they achieved is they severed the historical correlation between euthanasia and intake. And there's just really not anything cooler than that to me. Rehoming support. So what is it? what does it mean to help someone rehome their pets in the shelter? This study is a great one. I think Mel will try to drop the link in the chat, but it looked at a lot of factors, and there were some animal factors as well as human factors. But what their conclusion was that online supported self-rehoming platforms provide pet owners with an alternative to relinquishment that may reduce the intake to animal shelters. And I think some of these stats that are on this little slide are really cool to look at. So 87% of dogs and 86% of cats avoided shelter intake at all. And over a third of them were kept by the original owner. So having this time between when they could potentially surrender it to the shelter and they had opportunities to either rehome them or find solutions on their own, results in more successful diversion of intake. This figure is a figure from human social work. So the coordinated entry system is a system that's been used to assist unhoused folks in human social work for years. The human social work field has embraced that they cannot effectively help everyone at once. For those that do enter the shelter system, the coordinated entry system, which looks a lot like managed intake and intake diversion, helps folks enter the system in a way that best serves both the people who need to achieve housing and the system. And so I really liked this parallel of what it looks like to try to navigate finding pets homes without a coordinated entry system versus with one. So what happens when we're unable to divert the intake? What happens when they come in? So pathway planning is a proactive process that anticipates the service and care an animal will require to achieve an appropriate outcome. A pathway is selected in consideration of current available housing, personnel, resources, and the likelihood of achieving the outcome while maintaining good welfare. So it gives us the opportunity to plan ahead for the needed steps and prevents delays that add days to the shelter stay. When we identify a pathway early, we reduce any time the animal is spent not moving forward in the process. And if things are taking too long, we have response steps that take automatically. So we have a few different potential pathways listed on the screen, and this isn't all of them, but just some potential pathways to think about. And that is adoption. You have fast track and slow track, and we'll talk more about what that means. Return to owner, foster for medical or behavior, transfer, and utilizing rescue partners. Euthanasia is sometimes the ultimate pathway plan for an animal, or return to field. So fast track pathway. We're looking at our highly adoptable pets. So this is puppies and kittens always. And typically, in most communities, it's small dogs and purebreds. And I encourage you to look at your data. I think this is really fun. What does your community find highly adoptable? And I think digging into that data and not just trying to guess or like see what your personal impression is and see if you find anything interesting. If certain looks of dogs or sizes of dogs are interesting to your community, you may find that they belong on the fast track as well. And we have two competing priorities for two things competing for the #1 spot for priorities for this animal. It is getting them out and not letting them get sick. I messed up some animations there, but I will just emphasize that again. So these are typically our most vulnerable animals in our shelter. So we want to get them out, which is the best way for them not to get sick. But we also need to think about, especially in our puppies and kittens, how we keep them from getting sick where they get stuck in the shelter. So two competing priorities: get them out and keep them from getting sick. So here's an example pathway of what it might look like for fast track animals that are headed towards adoption at your shelter. And you expect these ones to just fly off the shelves. It's these cute little screaming kittens in this picture. We have day 1, we have our medical intake, our photo, we schedule spay and neuter for after their stray hold or tomorrow if there's no hold. We put them in a visible location in the shelter, And for some dogs, we might want to evaluate them for playgroup and participation. People love to watch playgroups. At one of our centers, people can come in and watch playgroups, which I think is a really cool strategy. I think people love to watch dogs play. And on day 5, they're still there. It's time to put a video of them on social media, encourage people to come in and see your cute itty bitties and get them out of the shelter. Okay, here's a different pathway, return to owner. So we see this dog running at large. He's recently groomed. He has a collar and a tag. And we don't want to use the word stray for this animal. This is a lost dog. Before we intake them, we should scan them in the field and see if they have a microchip and encourage our officers to follow up on that microchip in the field and avoid intake at all if possible. We want our officers to canvass the area. We have some stats coming in a couple slides, but most dogs are found pretty dang close to home. So start asking around, finding out if we can find where that dog lives. If we don't find their home before intake, then we typically do bring them to the shelter and we do a medical intake. We take their picture, we post them on social media. And on day 2 and 3 and any day before the stray hold is up, we want to pursue every avenue to try to get this animal home. So I highlight our priority here, which is get them home. So our itty bitties, our priorities are get them out and don't let them get sick. Our priority for this group is get them home. Now we have our slow track, and we all know who this dog might be in our shelter. And there might be some variation of what this looks like in your shelter versus others. But oftentimes it's a large breed, highly aroused dog. They're typically at risk for behavioral breakdown in the shelter. And so some of our strategies here are to prevent behavioral decline and focus on welfare and enrichment. We want to get this dog into playgroup. We may opt for starting this dog on behavioral medication right on intake. We want to do everything we can to make this dog appealing to transfer partners or adopters. We want to schedule spay neuter, waive fees, and promote far and wide. And I think one thing that is important to highlight is that although we may see this dog and expect them to stay a while and take appropriate steps, we don't want to discourage adopters from specific breeds or express our own biases to adopters for certain breeds. Another thing I'll say is these are dogs that we'll send to the news. We want to get them in a dog stay out program where they get to go to the brewery and get to be themselves. And I will tell you, I love taking dogs like this to foster, and I have had a number of foster dogs adopted from Ace Hardware that is higher than 1. So thinking about unconventional places to market some of these slow track animals where you might find people who are interested in these big high energy dogs. One other interesting statistic I just read recently was that Gen Z is about 10% more likely to adopt a large breed active dog than any other generation. So when those Gen Z adopters come in your door, bring them right down that large dog aisle. I mean, we really want to get these dogs out and get them active. And so I really love that statistic and just wanted to share. But our priorities for this group are welfare and enrichment. And once again, we have a competing priority of get them out. So the answer to improved welfare is getting them out of the shelter. But when they're in the shelter, we really want to focus on welfare and enrichment for these pets. Another example pathway is return to field cats. So on day 1, we have their medical intake, their photo, and we want to schedule them for surgery as soon as possible and house them in a low stress area. These cats are often struggling in the shelter environment, and then we want to release them as soon as possible. So these are cats that maybe didn't get into the TNR pathway. They came into our shelter, but they were a stray, and so they ultimately have a pathway of returning to field. And so our priority for this group is surgery and release. And so thinking about our different priorities, like we take these big groups, we assign priorities, we assign a pathway, we assign a timeline, and it really just helps us think about each of these groups clearly. Okay, I mentioned spay and neuter. So What age is everyone spay and neutering at? Go ahead and put it in the chat. See if I can see it again. The answer is on the screen. 2 pounds, 2 pounds, 2 pounds. Cool. Yeah. I mean, that's what spay neuter vets do. We do it at 2 pounds. And yes, so age or weight, or some combination of those two factors, is often what shelter vets are using to decide when they're ready for spay and neuter. And so these 6-week animals, so on the screen, you'll see 6 to 8 weeks. These are our robust, healthy kittens and puppies. And so I say all the time at the spay neuter clinic, not all 6-week-olds are created equal. And so I tend to be a little more discriminatory with my pre-surgical exam on a 6-week-old kitten than I am at an 8-week-old kitten. And these 6-week-old kittens may seem really young, but here's why. If we can't adopt them until spay neuter, and especially if they're housed at the physical shelter, this is the most dangerous place for them to be. We're talking about disease, stress, which leads to more disease. We really just want to move them through the system. And we're talking about 6 to 8 weeks. We can knock weeks off our length of stay if we do this. Even in foster, our foster space is limited too. If there's no kennels and if there's no foster homes, then we're left with euthanasia for space. So we want to move them through foster homes as fast as possible so we can place a new litter in that home that needs care. If we are doing them at 6 weeks or 1.5 pounds, which I've started doing in the last year, and at first it's scary and then it's really fun. I lovingly refer to it as hamster surgery. There's some precautions we should take. So they are more prone to hypothermia, hypoglycemia. We really want to watch that heart rate and use reversible drugs. So we are happy to share our drug protocols. Our emails will be at the end if you're interested in any of those, and feel free to reach out and we can get those to you. So pediatric spay neuter, we want to proactively schedule animals for surgery. And so what this can look like is the day they come in, they're assigned a surgery date for 6 weeks. And for me, what this looks like is they're assigned a date for 6 weeks, and then they get weighed by their caregiver at 6 weeks old. And if they're still itty bitty, they don't come in for that surgery date, they get bumped 2 weeks later, and then we'll see them when they're 8 weeks old. And so for us, 2 pounds versus 1.5 pound kittens, we've seen no difference in complications. And then it makes us able to adopt them within their critical socialization period. I will tell you 1.5 pounds is a routine practice for many shelters. And I say 750 grams in my shelter because I make everyone use kilograms against their will. So 750 grams or 1.5 pounds, and they're a little different, obviously, but I like to have those nice round numbers to help everyone. But consider a trial. So if you're starting to think about, maybe I could do them at 1.5 pounds, maybe I could do them at 6 weeks, maybe try it for 2 months and track your data and see if you do find that it's working for you. When you're making your surgery schedule, we want to assign priority surgeries to the right animals. So the number one highest priority is RTF cats. Their pathway is clear. They cannot leave until they have surgery. So arguably those cats need to have surgery first. And our adopted pets waiting to leave. Once again, they have an outcome. All they're waiting for is spay and neuter. Maybe we do those animals first. And we can also consider adopting on a waiver. And so this can look like adoption with a waiver to go to a different vet and provide support, or it can look like doing in-house, or maybe it just looks like encouraging them to find spay and neuter services elsewhere. Our medium priorities are fast track pets. And I know it's crazy. I just told you to get all these guys into spay and neuter, and now I'm telling you guys they're only a medium priority, but only second to pets that can get out of the shelter as soon as they're spayed and neutered. And our lower priority are pets that have already left the shelter and are awaiting spay neuter. We all know what those backlogs look like, and our slow track pets. And so when we do have those pets that have already left the shelter, I would think about maybe not leaving them as foster to adopt if you're losing them to follow up, just outcoming them. What we know is that pets that have left in many communities, the rate at which adopters find their own surgeries is high. So our common bottlenecks, we talked about spay and neuter. Our other bottlenecks is The other bottleneck that's important to highlight is intake treatment. My priority as a shelter vet is that all the animals get vaccinated, but sometimes it's hard to get everyone else to see that being their number one priority as well. But what can we do in our shelters to ensure that they get their vaccines within minutes or hours or before they get there? And the rest that are maybe less susceptible get it within that first day. So kind of triaging who needs intake immediately, who can wait till after lunch. My preference is none of them would wait till after lunch, but something's got to give. Behavioral assessment. We see this quite a bit where animals, the bottleneck from intake to making them available is a behavior assessment. And we have research now that shows us that behavioral assessments, they're largely poor indicators of post-adoption behavior. And so formal evaluations are not recommended. We want to interact with animals in normal ways, document that behavior objectively, and then have open conversations with the doctors about what we saw, what their history is, and counsel them on how to best set them up for success in the home. This brings me to another strategy. Everyone is available, almost. So letting adopters and rescues decide what they're willing to take on. We don't have to fix every issue. We can adopt and transfer with a waiver, and there's only a few exceptions to this. And these are animals that are truly a danger to the public, court holds, animals that are medically unstable, unable to transfer safely, and this is really such a small number of animals. Open selection. This means all the animals in the shelter, as a default rule, are visible and available. And this includes stray holds or other holds, and it might include strategies like pre-adoption or foster to adopt. Water break. If an owner comes forward, the owner goes to them, clearly, if they're on a stray hold, but it's mostly about being clear and setting honest expectations. Should those animals leave the building? That's up to you. And maybe it's on a case-by-case basis and based on your data. If the answer is we can't let them leave without spay neuter, the ordinance says so, thinking about strategies like foster to adopt and really just getting creative on how we get animals out of the shelter. This study from JASMICA, which is a funny acronym for Journal of Shelter Medicine and Community Animal Health. They have these visual abstracts that I think are really fun so that you don't just have to look at papers. You can look at these little images that are generated from the abstract. But they looked at the effect of viewing sessions on adoption outcomes, letting people see the animals. What they found is that adoptions increased over 50%, and this was especially true for long stay dogs. And the group that they called long stay were greater than 9 days. So open selection, everyone's available. You can see everyone. If someone is not available today, maybe we can arrange for a pre-adopt. Maybe you have certain strategies for how that's going to work for you. But really just encouraging adopters to be able to see everyone and let them pick. Open adoption. So we often feel that it's our responsibility to ensure the care of animals, even after they leave our shelters. This commitment often leads us to the search for a perfect adopter and implement practices that weed out those who don't fit our criteria. But what's good enough? And how many prospective adopters go elsewhere to adopt or purchase animals because they don't fit our concept of an ideal home? So this is my dog Tuga and me on the slide, and he's my open adoption story. He was the only dog at his South Florida shelter who had made it onto the roof. So I'm sure you can make some deductions about his personality. I was 22 years old when I wanted to adopt him, and I would call myself a little irresponsible at that time. But I loved this dog when I met him at the shelter. The shelter had some ideas of who should adopt him. They had an application, which I did fill out. They had a landlord check, which I brought the piece of paper home and I had my roommate fill it out. They thought that he should have a male adopter. So I got one of my friends. Oh my gosh, I'm coughing. So I got one of my friends who works on a fishing boat to come adopt him and sign the paperwork. And they also required 3 visits. Sorry. They really didn't want me to adopt this dog. And maybe I shouldn't have. But I'll tell you, where there's a will, there's a way. I'm not crying, I'm just coughing. We went to vet school together. We lived all across the Mountain West. We fostered 50 dogs together, I think more than that now. And we've been together for more than 10 years. And so instead of long applications and hoops to jump through, we have conversations. And let's reduce or waive adoption fees. And you may ask, what about the loss of revenue? So remember from earlier, we looked at the cost of care per day for animals in our shelter. Let's look at an example. So we have shelter A with 6,000 annual intake. This includes 3,000 dogs. The cost per animal, regardless of stay, is $100. So this is things like vaccines, spay, neuter, the cost of intake, and then the cost of care per day for this particular example is $10 per day per dog. Their dog adoption fee is $30. But when Shelter A waived adoption fees for the month of August, the average length of stay for dogs dropped from 21 days to 15 days. The average cost savings due to reduced time and care for this particular example is $60 per dog. That's a net savings of $30 per dog. If we look at 150 canine adoption outcomes for August, we're saving $4,500, and that's $54,000 annually. I recognize this is simplified. You have the same staff, even if the animals are leaving. But who's fully staffed? Maybe instead of money, it's extra time. What do you do with that extra time? Things like enrichment, intake diversion, and community outreach. Once again, building more robust foster programs so dogs and cats get to live in a home while they're waiting for their long-term family. And our shelter medicine team knows shelters that haven't charged a single adoption fee in years, and they still keep the lights on and they still serve their communities. So more on open adoptions. I encourage you to look at when your adoptions are actually happening. So look at your adoption hours. Oftentimes what we find in shelters is that they're happening on nights and weekends. Try new hours and then look at your data. There was a survey done by Hill's Pet Food, and they found that 30% of potential adopters think the adoption process is too difficult. And they found that this is particularly true in historically marginalized communities. Examples of why they thought it was too hard is that it can take too long, they can't get to the shelter when it's open, and they don't know if the shelter is accessible for all abilities. And what happens when we deny adoptions? Those folks go elsewhere and acquire a pet. We can give them a fully vetted, sterilized pet that won't contribute to future intake at the shelter. And I know what happens when we start to talk about open adoptions. We think about, but what about? What about the one case where something turned out really bad? What if we could have prevented that? And what I'll say is our work regularly exposes us to animals in need, unclaimed lost pets, families who need to relinquish their pets, injured or ill pets, and victims of abuse. With ongoing exposure to stress and trauma, your view of adoptions and adopters will change over time. While a perspective shift is normal and predictable, if these changes go unrecognized and unchallenged, they can damage your adoption efforts. So this graphic is from the Adopter's Welcome Manual from the Humane World for Animals, and it just looks at how many dogs and cats live in homes in the United States and how many go through the shelter system. And so we are dealing with just a small number, a very skewed number of animals that actually exist in our country. And so when you think about your perspective, remember that it is skewed from our own experiences in dealing with this small fraction of pets. And anyone who knows me knows that I can't give a presentation without including this graphic. And so we know that we only interact with a very small fraction of pets in our country, but we also only see the smallest glimpse into our adopters' lives. the story we tell about who they are from the one time we interact with them, it can be good or it can be bad, but what we know for sure is that it's not the whole story. And so remembering this when we're interacting with adopters, and this is from sparkinsight.org, and they have great manuals about improving our worldview and thinking about things from the perspective of pet owners. And what does the evidence say? I'm starting to run short on time, so I'm going to try to see if I can pick up the pace a little bit here. But these are just 2 studies. And I know Mel will drop the link in the chat, but what the literature is finding is that open adoptions and waived fees don't result in a difference in quality of care. There's no difference in retention. We have no data to support we're actually any good at screening adopters. And there's no difference in attachment or return rates when we waive the fees. The takeaway from this slide is just, these aren't just ideas, data support these programs. Adoption-based or conversation-based adoption counseling, it's really just trying to figure out what that person is interested in. They may think they want a small dog, but what they actually want is something that'll sit on the couch with them and they can take on the subway. So maybe they want a cat, or maybe there's something else you can show them that matches their interest. And what if it doesn't stick? I included this particular slide in reference to adoption returns, because I think we need to view our adopters and our fosters and everyone else who's working in our community care for animals very similarly. So we need to view returns as fact-finding missions and no different than short or long-term foster. Can we help them find a better match? We want to keep them in the adopter pool. I really think the future of animal sheltering is community-centric, and we've covered most things on this slide already, but some ones that I love to highlight are recognizing community cat caregivers as partners, and being advocates for pet-inclusive housing insurance. Don't underestimate the power of good marketing. This is one of our profiles, so the call is coming from inside the house, but there's no bio, there's no photo, and this is not very appealing to potential adopters. And so how do we get people to come in and want to meet dogfish? And maybe it's a picture like this, right? Assigning or taking really engaging photos and writing good bios can be super helpful. Another strategy I love is using QR codes with out-of-kennel behavior if their in-kennel behavior isn't great, so they can actually see what those pets are like. We want to shift our language from stray to lost when we know the goal is return to owner. We know that microchips increase return to owner rate quite a bit for dogs, but even more for cats. We also know that dogs and cats are typically found very close to their home. And so operationally, what does this mean? We want to encourage finders to keep strays in the neighborhood, knock on doors, drive around, try to find where that pet lives, and that's going to be the best way to get them home. When we're talking about low-income communities, those that make less than $30,000 a year, they're half as likely as other populations to find their lost pet at the shelter. So what I would say is in those communities, it's even more important that we go door to door, knock on doors, hang up flyers, and make it really accessible. RTF, we want this to be our default option for cats with stray intake. Socialization status is not a factor. Who is excluded if they have an unsafe return location, they have no known return location, they have a medical that can't be treated with just a point-in-time treatment, or very young age. We know that RTF is the best way to get cats home. 3% is the national average RTO rate for cats from the shelter, and so RTF is quite a bit higher. When we talk about very young age, I wanted to highlight that we don't want to encourage kidnapping. If very young kittens are found outside, we want to wait and watch up for 8 hours for mom to come back. If there's no mom, then we encourage the finder to foster. But ultimately, the best case scenario for those kittens is that they are raised by their mom. And we couldn't get through a population management presentation without bringing up daily population rounds. What I'll say is that we have an entire webinar on daily population rounds. Mel will share the link to that. So there's an entire other hour you can watch on daily population rounds. And I won't go over too much here because I really encourage you to go check out that content. But We want to review our average length of stay on a regular cadence and intervene when we see trends that we don't like. Ultimately, we have to be proactive when it comes to animals coming in and to population management. We know from day one, this dog is probably going to stay longer than our long-haired dachshund. So what can we do? We can waive adoption fees. We can do giveaways with adoption for this particular dog on day 1 or day 0. We can do a social media highlight, prioritize for foster care, schedule for surgery, and then really above all, we need to be doing behavior and enrichment planning for this dog, especially if we think that they're going to stay in the shelter for a while. Potential barriers. So bonded pairs, mandating adoption together, increased length of stay by 13 days. And this doesn't mean that they can't live together when they're at the shelter if they're buds. What we know is like the best thing for these animals is to get out. And so it doesn't mean they can't be adopted together, but we want to be really careful about mandating it. These are some examples of signage that will keep your animals in the shelter. And so maybe all of this information does go in adoption counseling. And we do want to let adopters know about history and about our objective behavior notes. But this kennel signage isn't doing anyone any favors. Same with our itty bitties. We know adopter interaction matters. And so I know we want to keep all of our animals safe, but balancing that with life-saving and positive outcomes is actually the best strategy for keeping them from getting sick. Behavior holds. We're not talking about court hold dogs here, or actual dangerous dogs. But what we want to do with general behavior animals and medical holds is to disclose and let the adopters decide. Here's my example. This is Foxy. She was unavailable, unadoptable due to her dental disease and her skin condition, and maybe some struvite crystals. She is a crusty, which means she's a Chinese crested Yorkie mix. And I was pretty darn sure that if I just made this animal available, I could get her adopted. So I took her home with me, wrote a few disclaimers, made her available at one of our centers, and she got adopted in 2 days. The adopters drove 2 hours to pick her up, and they took her to her favorite vet and got the works done. And how do we reframe some of our medical conditions for adopters? So this is a sign we might see somewhere: ringworm, not available, wear gloves, is contagious, which is all good practice, but maybe not the most inviting to adopters. So something like the fungal jungle. So this is from our New York center, where they have all of their ringworm cats in one area. They have a QR code where you can learn more about ringworm and what it would mean to adopt a ringworm cat. They use engaging photos so that you can see all of the animals that are currently being treated for ringworm. And so just reframing what this might look like. I think we're getting close. Another example is FIP. We're currently adopting out cats that are currently in treatment. And so I want to share this video with you because it's so cute.
Hi, I'm Matt. I'm a volunteer at Best Friends, and this is Nathan. He is a very, very friendly cat, and he'll make a great addition to your family. He has FIP. He's an FIP survivor, and he has about 1 month left to his treatment, which is 1 pill a day. As you can see, he loves people, and I think he'll make a great addition to any household.
As you can imagine, that did very well on social media, and he got adopted the next day.
Hi, I'm Matt.
Oh gosh.
Let's
see if I can. So we just want to highlight every single day matters, both for the individual and compounded over time for the population. And our key points so that we want to implement life-saving programs. Proactive population management is life-saving, and remove barriers to get animals out. And in conclusion, we just have some more resources. I know Mel already dropped a bunch in the chat, so you could read for the rest of the week, but here's my contact information if you have any questions, in our general shelter medicine email. And I think we're out of time, but I will end my slideshow and see where we're at. Okay. Well, thanks everyone for coming. I don't know if we have time for a Q&A. I think we're probably out of time. But I hope you guys all took something away that is helpful for you in your shelters.